Hey, how's it going, everyone? This is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 24 of my multi-part video series providing a broad overview of the discipline of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to open up talking about the posterior gastric ulcer. The posterior gastric ulcers can penetrate the rear wall of the stomach and extend into the pancreas while causing pain referred to the back. The erosion of the splenic artery is a frequent occurrence in the posterior gastric ulcers due to its close proximity to this wall. I have a visual representation of a gastric ulcer on the picture to the right so you can kind of visualize where it occurs in the human body. Let's go ahead and move on to the next concept. Next, I'd like to talk about congenital diaphragmatic hernias. This refers to a condition where the stomach or intestines protrude through a defect in the posterolateral aspect of the diaphragm, known as the foramen of Bach-Dulac. This condition primarily affects infants and is associated with a high mortality rate due to the development of left lung hypoplasia. And as always, I have a picture to the right showing a visual representation of what a diaphragmatic hernia looks like. Moving on to the next concept. Next, I'd like to talk about sliding hiatal hernias. A sliding hiatal hernia occurs in individuals past middle age, results from the herniation of the stomach's cardia into the thorax through the esophageal hiatus of the diaphragm. This condition can lead to damage to the vagal trunks as they traverse through the hiatus, resulting in decreased secretion of gastric juice. So I have a picture to the right here that showcases different types of hiatal hernias. So we have a normal esophagus and stomach, then we have a hiatal hernia type 1, which is known as the sliding hiatal hernia. Then we have the type 2 hiatal hernia, which is known as the rolling hiatal hernia. Then the type 3 hiatal hernia, known as the mixed hiatal hernia. All right, that should do it all for content. Let's go ahead and take a look at some questions. I know you guys love them. Which of the following statements accurately describes a characteristic of posterior gastric ulcers? Alright, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. This statement accurately describes a characteristic of posterior gastric ulcers as erosion into the pancreas can lead to referred pain felt in the back. Therefore, the correct answer is C. Referred pain to the back is a potential consequence of posterior gastric ulcers eroding into the pancreas. Let's take a look at why the other answer choices are incorrect. Posterior gastric ulcers typically cause referred pain to the abdomen. This choice incorrectly suggests that the pain associated with posterior gastric ulcers is typically felt in the abdomen, whereas it is actually referred to the back. Posterior gastric ulcers commonly erode through the anterior wall of the stomach. This statement inaccurately describes the location of erosion for posterior gastric ulcers, as they typically erode through the posterior wall of the stomach. Posterior gastric ulcers rarely affect neighboring blood vessels due to their location. This option falsely implies that posterior gastric ulcers seldom affect nearby blood vessels, whereas erosion of the splenic artery is a common occurrence with these ulcers. The erosion of the splenic artery is uncommon in cases of posterior gastric ulcers. This choice incorrectly suggests that erosion of the splenic artery is uncommon in cases of posterior gastric ulcers, whereas it is actually a common occurrence due to the proximity of the artery to the posterior wall of the stomach. Moving on to the next question. What defines congenital diaphragmatic hernia? Alright, I think I gave you guys enough time there. If you need more time, please feel free to pause the video. Otherwise, moving on now. This option accurately describes congenital diaphragmatic hernia by highlighting the anatomical location of the defect and the resulting herniation. The option referred to here is C, where it mentions that a congenital diaphragmatic hernia is characterized by the herniation of the stomach or intestines through a posterolateral defect in the diaphragm known as the foramen of Bachtellack. Pretty first order question right from the slide. Let's go ahead and take a look at why the other answer choices are incorrect. It involves the protrusion of abdominal organs through an anterior defect in the diaphragm. This choice incorrectly describes the location of the defect in congenital diaphragmatic hernia. The defect is typically posterolateral, not anterior. It affects primarily adults and is associated with a low mortality rate. This option presents inaccurate information. Congenital diaphragmatic hernia primarily affects infants and is associated with a high mortality rate, particularly due to respiratory complications. It commonly occurs in the elderly populations and is often asymptomatic. This statement is incorrect. Congenital diaphragmatic hernia is a condition present at birth and typically diagnosed in infancy. It is not common in the elderly population and it often presents with respiratory distress and other symptoms. It predominantly results in right lung hypoplasia in affected individuals. This choice provides incorrect information regarding the lung involvement in congenital diaphragmatic hernia. It typically leads to left lung hypoplasia due to the herniation of abdominal contents and compression of the developing lung. Let's go ahead and take a look at the last question for today. What is characteristic of a sliding hiatal hernia? Kind of a wordy question here, but all you need to do is recognize which age groups is affected by slidal hernia, and then choose the proper answer choice from there. Sorry for completely butchering that. Sliding hiatal hernia and age groups of patients. So with that, I'm going to go ahead and move on now. If you need more time, please feel free to pause the video. Moving on now. Sliding hiatal hernia primarily occurs in individuals beyond middle age, resulting from the protrusion of the stomach's cardia into the thorax through the esophageal hiatus of the diaphragm. This statement accurately describes the characteristic features of a sliding hiatal hernia. Therefore, the correct answer is A. Sliding hiatal hernia primarily occurs in individuals beyond middle age, resulting from the protrusion of the stomach's cardia into the thorax through the esophageal hiatus of the diaphragm. Let's go ahead and take a look at why the other answer choices are incorrect here. Sliding hiatal hernia predominantly occurs in young adults caused by the herniation of the pyloric region of the stomach into the abdominal cavity through the esophageal hiatus of the diaphragm. The statement is incorrect as sliding hiatal hernia typically occurs in older individuals and involves the cardia of the stomach, not the pyloric region. Sliding hiatal hernia typically affects infants, resulting from the herniation of the fundus of the stomach into the thoracic cavity through the esophageal hiatus of the diaphragm. This statement is incorrect as sliding hiatal hernia is more commonly observed in older individuals, not infants. Sliding hiatal hernia is mainly seen in adolescents, resulting from the protrusion of the gastric antrum into the thoracic cavity through the esophageal hiatus of the diaphragm. This statement is incorrect as sliding hiatal hernia typically occurs in older individuals, not adolescents. Sliding hiatal hernia primarily affects elderly individuals caused by the herniation of the entire stomach into the abdominal cavity through the esophageal hiatus of the diaphragm. The statement is incorrect as sliding hiatal hernia involves the cardia of the stomach, not the entire stomach, and is not limited to the elderly population. Guys, that will do it all for the video today. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If you have any doubts on these topics, we'll be covering them in the gastrointestinal high yield review series that should be coming out soon. I have very limited time, but I will try to finish all of these review series, the first iteration at least by the end of the summer. So stay tuned for that. And I'd appreciate if you guys could leave a like and subscribe to this channel for more content like this. But this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.